Good afternoon, everybody, and welcome to our conversation this afternoon with Governor Phil Murphy of New Jersey. Governor Murphy joins us today to discuss COVID and some of the health and economic developments taking place in his great state. Before his election in 2018, the governor spent nearly 25 years as a distinguished leader at Goldman Sachs before he became a U.S. ambassador to Germany, which is one of my home countries as a dual citizen. So he had a great tour there, and over the years has engaged in a number of civic and philanthropic activities. Today, as governor, he brings those life experiences and leadership skills to really drive forward the success of the state of New Jersey now and into the future. At this time, he also serves as chairman of the Democratic Governors Association and has a full plate in front of him as the state elections are taking place across the country. Without further delay, however, I'd like to begin the conversation with the governor and start with a few questions around COVID-19 and what it's going to take to bring this country together in the future, and hopefully sooner rather than later. Over the course of the last 6 months or so, I've been known to say that the virus is like a thief in the night that has spread in ways that we could never have imagined or predicted, creating chaos, lost opportunity, and heartbreak. Today, we find our country pretty divided along party lines or ideologies, and we receive our news and information differently depending on where you might be in that divide. So, as a leader, how do we go ahead and approach this, and how we communicate with these constituents when we know that some of our messages people aren't really listening to? And how do we get them on board so that we can make a difference, especially when you're looking at COVID and how we're treating it?
Ed, it's good to be with you, and I appreciate your having me on. And the question is incredibly important right now. So I'll tell you how we've approached it, and perhaps there are lessons that have a broader audience for that. I'd say most importantly, we have been doggedly Moneyball in our approach. So we have made decisions at every step of the way based on science, fact, and data. And I say that not to pat ourselves on the back, because New Jersey suffered an enormous toll, and we're still not out of the woods, although it's dramatically better than it was 6 months ago. I say that because I think if we stick to the facts and you stick to what is scientifically known and proven, you have a much firmer ground to stand on. And even though you may take incomings for a period of time, ultimately we believe that the facts win out, the science wins out. So I'm hoping, like everybody else, that we get a vaccine sooner than later, that it's efficacious, that it's safe, it's scalable, that we get therapeutics maybe even sooner than that. But in the meantime, what we have at our disposal is very basic stuff. We have social distancing, face coverings, washing your hands with soap and water. Take yourself off the field if you don't feel well or you've been exposed to someone. Let it incubate for a few days and then get tested. So that's what we've got. That's the hand that we have been dealt. And I think if we're dogged about staying on the facts and sticking to the facts, and we remind people constantly that that's all we've got, I think ultimately you can't win everybody over, but ultimately you reach enough. And I would say one other part of this that we've held on to from moment one. I've been trying to channel even just a fingernails of leadership of Winston Churchill in the early 40s, in that period, 1940-41, when the Germans had taken over the entire continent and the Americans were not yet in the war. And Churchill balanced two sort of impetuses that seem at odds with each other, but were in fact quite harmonious. So we've tried to do that as well. On the one hand, brutal honesty, again, based on the facts. And on the other hand, giving people a real sense of hope, a real sense of if you do X, then Y can happen. And I'd say lastly, Ed, we have never given up, even though the data, the science, the facts drive us. Every single day we get behind the podium, we memorialize usually a handful of folks who have been lost to this virus. So that while the data it matters most, we have to remember that these are extraordinary lives that have been lived and lost. And to me, that is the right mix in terms of an approach. We're not perfect, nobody is, but that's been our approach since day one.
Okay, thank you, Governor. I think, as you said, New Jersey got hit early and pretty hard. And you made a remarkable few steps forward to bring the state ahead of the curve a little bit. After every disaster, whether you go back to Sandy or you look at the pandemic and both different types of disasters, but we always say when we finish these things that we're going to be better next time. So, and sometimes we are, but the investments don't necessarily flow in the same way. So if you're looking right now at what we've learned so far, what would be the key messages you would want the constituents in your state or the people around the country to understand what we've learned, what we can do better next time, and how would we be better prepared?
Yeah, again, a great question. And by the way, I'm going to answer it straight up, but I think you'd agree with me. The other trap we could fall into is that we fight the last war, not the next war. So, right. So my guess is whatever it is that's going to come up against us may have some similarities and may have some substantial differences. But having said that, we had as a nation and as a state, we had no strategic reserves, and that has got to change. We need national strategy and we need state-based strategy. So we're not going to learn that lesson twice in New Jersey. We are well into the process of having 98 million pieces of personal protective equipment in our own stockpile by the end of the fall. That stockpile was at zero at the beginning of this. We have substantial bed capacities that we have built out and we will retain. We will have, by the end of the fall, 2,600 ventilators in our stockpile. So this is all just at the New Jersey level. We now know and have registered an army of surge healthcare workers who we had defined early on in this crisis. I think another huge lesson, Ed, though, and this is a broader lesson, both in our state and I think more importantly nationally, we've underinvested in public health. And that's been going on. It isn't just this federal administration. That's been going on for a while. And we can't keep doing that. We have got to invest in the institutions, in the research, in the manpower and the science. We need a much stronger national public health backbone. And I say that's a broader point because, as I mentioned at the beginning of this answer, I can't believe that our next fight is going to look exactly like COVID-19. We just can't assume that. So on the one hand, we have to buy the insurance policy if it looks like it. And I'm wrong about that. And we do have a pandemic that plus or minus requires the same amount of capacities and stuff. But on the other hand, our public health spine as a nation has got to be stronger and broader so that it encompasses not just our ability to look around the corner, but the whole range of what could come upon us going forward. And those would be my big wishes, my magic wands, if you will.
And what would be the one or two areas within the public health infrastructure that you think we should try and tackle first?
I think it would be a much deeper investment in CDC, a much deeper investment in the NIH, National Institute of Health, much deeper federal support for research, especially viral-related research, at whether that's in federal auspices or done at our research universities. And we've got in New Jersey, we're proud of having some of the finest in the nation, if not the world. That it'd be that sort of stuff. I think public awareness, I think will continue, Ed, to be a big item. Dr. Tony Fauci's been hugely helpful and important for us in Jersey. He would want me to remind everybody that just because we get therapeutics or even better yet, a vaccine, he reminded me that I got a flu shot a few weeks ago, but we still have the flu. So this, the vaccine's a huge step, but we've got other sort of public awareness stuff like social distancing and all that sort of stuff that we've gotten used to that will probably be a part of our ongoing lives.
Yeah, Tony, coming from New York City, spent a few days in New Jersey playing basketball. I, I guess it was against St. Peter's Prep and a few of the
That
others.
sounds right.
And
And he married a Jersey gal from Livingston.
yeah, and so unfortunately the basketball results for him in that state didn't work out too well for him. But it's he
He
was
told me, he told me
a
he
feisty
inherited.
guard, I will tell you.
Exactly. He told me he inherited his father's genes, which made him the fastest kid at school, but he only capped out at 5 foot, whatever he is. So as much as he loved playing basketball, his future was limited at the end of the day.
Absolutely. I think the one thing he said to me is a dear friend of mine is George Blaney from Jersey City, and they played against each other. And he said and they both went to Holy Cross, and the comment was, once I played against George in that tournament, I knew that college basketball was not in my future. So it's
Exactly. Great story.
but if you go a little bit more, let's take a look at what you and your wife have been doing in the state. Um, Clearly, the maternal health outcomes were not what you wanted when you came into the state, but you and your wife have tackled that. And if you could just sort of share with us a little bit about what that program looks like and how ultimately that's going to help women and children's health.
Yeah. Again, these are great questions. So we've got a really bad reality in New Jersey. You would think I wouldn't have guessed that New Jersey would have this reality, but we do. We have among the nation's worst Black maternal infant mortality rates. The chances of a Black child within the first year of life or a mother in the process of giving birth, the chances of their not making it through are multiples of what they are of their white peers. And when we got into office, we were dead last. And so I do want to give a shout out to my wife, the First Lady Tammy Murphy, who's tackled this. As we've said so often, COVID-19 didn't create the inequities, but it's laid them bare. And frankly, the maternal reality had long before laid them bare in our state. So we've tackled it. And again, she's been playing an extraordinary leadership role here, working across all of government, including with our legislative partners. She established something called Nurture NJ, which is a whole broad sort of holistic approach, putting doulas up on a pedestal at long last in our state. Public awareness. She's gone around the state and has hosted basically maternal days when all providers and stakeholders come together basically in a big fair, and mothers and families can go and learn a lot about the whole process. I've signed, and she has helped, as I said, work with legislative partners and other parts of government. I've signed a whole range of laws directed at shrinking that gap. She's got high hopes to have a center of excellence on Black maternal infant mortality and solving that riddle based in New Jersey, a national center, or would have national reach. So there's a lot of different steps we're taking, and she's taking, I have to say, she's been taking the lead. And the good news is it's getting better, but it's going to take a while. It's like one of these legacy issues that we've been digging out of for decades, frankly, centuries in communities of color. But we're going in the right direction at long last.
And that's great. I think when we look at the conversation around health and economic equity that took place or began again this summer in a more meaningful way, sad in many ways in which the way it started, but if we can get where we need to go, I think the conversations will continue and opportunities will continue as well. I think if you have an opportunity to ask anybody here that's in the audience today that's paying it, spending time with us, what would you ask them to do? What are the barriers to success in that? Is there something that people that are listening in today could be doing differently to help?
Specifically on maternal and infant health?
Correct.
Yeah, I mean, I think demanding wherever they may live that public awareness knowing where to get the answers to your questions, knowing what questions to ask, having one place. Again, in New Jersey, we call it Nurture NJ. It's a one-stop shop. And what my wife has found, and what many others have known for a lot longer, especially in our communities of color, is you didn't know what questions to ask. If you did know what questions to ask, it wasn't clear where the answers were coming from, and you didn't know where to go for either. And so having a central place in each of our states, frankly, it's worthy of a national campaign, I have to say as well, but at a minimum in each of our states, knowing where to go and who to ask for help and what questions you should be asking and how to discern the answers. I think it's a huge knowledge reality. In some cases, yes, I'm sure it's pure resources. It's also, by the way, Ed, this is a broader topic. It's why we have, from moment one, been obsessed with expanding access to health care and health coverage, and affordable health care and health coverage. We're building our own state-based exchange that we're going to launch on November 1st. We've taken matters into our own hands, and part of that is a big subsidy toward folks who heretofore could not afford health care coverage. So it's not just the specific questions around infant and maternal mortality and health, but it's the broader social determinants of health and what levers we can be pulling to make that reality a lot better than it's been.
Oh, thanks. You've had a pretty busy week with some announcements there, and and one was around Get Covered, and the other is how you're going to reopen. And there's a lot of back and forth on the East Coast with cities and areas right now on how they reopen. Could you spend a minute just telling us a little bit about what you have planned and your support restaurants and small businesses as well as those in need?
You bet. And we've really already covered the getcovered.nj.gov. Right. So the enrollment period's on November 1st, but the website's up and running as of a couple of days ago. And we're really excited about that. Yeah, listen, we always say public health creates economic health. So crushing the curve was job number one, and we couldn't transpose those steps. And while we're not out of the woods and we still are printing cases every day, sadly, we also have to accept the fact that we're going to have to find a way to balance and get our economy back up on its feet. We started to open things up in May. We're continuing to open things up. And we have at the same time tried to be there in this hour of need for the folks who are unemployed, the small businesses that have been crushed, restaurants in particular. So we've been trying to be as creative and as aggressive as possible, for instance, in deploying coronavirus relief funds. So this week, as you rightfully point out, Ed, we announced $100 million exclusively to small businesses, with a big chunk of that into food service, so restaurants, breweries, food banks, the like. Another chunk more in just grants to our small businesses. Another chunk further to help small businesses get the PPE that they need. Another chunk again to give folks relief on both the rental and the landlord side. I'd use this opportunity, Ed. No state has enough resources, no matter how flush you might be. There's nothing that can take the place of a big federal role. It's the existential role the federal government plays. It can print money, we can't. The response in the spring into early summer was very strong, whether it's unemployment insurance, small business help, the coronavirus relief funds that we've been able to put into education and other areas. We need more. And it's not just New Jersey. It's not just a blue state or a red state thing. We need a big federal jolt for all of the above reasons, including at the state and local government level. So that's my plea right now, that we get that big jolt. I think history will not be unkind if we overcorrect. I think it will be brutally unkind, and it will be paid through human suffering if we undercorrect right now.
So one final question. I have like 30 more questions, which is always my problem, that I can never get to ask everything I want to go through. But
I've
you've
got
been in
one for
office
you, by
for,
the way, too.
oh, well, I hope I can answer it well. So you've been in office for 2 years now, and what
Almost
keeps you
three,
awake?
believe it or not.
I understand, but it's what keeps you awake at night as you're looking at the future of New Jersey and the country?
Boy, these are all great, profound questions. I think that in the here and now, keeping as many people alive as possible, that continues to be job number one. As I mentioned, we've come a long way, but over the past few weeks, the numbers have gone up. People are still passing away. It's a lot better than it was, but facing colder weather, the twin-demic potential, I hope, please God, not, the so-called second wave, holidays, folks gathering more inside. I think that's the immediate thing that keeps me up to do everything we can to keep as many of us as healthy and as alive as possible. And I'd say in the intermediate to longer term, that the state gets back on its feet, that the folks who haven't had COVID but have nonetheless suffered, especially those who are unemployed or small business owners, that we get back on our feet as soon as we can, and that we can not just get back on our feet, Ed, and go back to where we were, because we've seen, among other things, these yawning inequities, but get back on our feet and get to a place that we need to be, a place that we've never been before. And I'd say, thirdly, as a nation, that we lay down our arms, we come together, we find common ground. It doesn't mean you have to give up your principles. You can hold your principles dear, but I think there needs to be a spirit of goodwill and brotherhood, and finding an earnestness about finding that common ground and turning a page in our current history. And it isn't any one person's fault. Certainly, others can throw more gasoline on the fire than others can, but we need to come together. We see that to some extent in New Jersey. I think we probably have it luckier than other places right now, but I think as a nation we need to find that soul again that leads us to the common purpose of this great nation, and to continue to try to perfect it each and every day.
Yeah, I thank you for that answer, because I would agree with you. I think that regardless of where you are in whatever part of the divide, everybody wants what's best for the country and the people around them. So if we've
Amen.
got to get back to finding out what that might be, so we can get it together. I do think that when we talk a little bit about this, and I know I'm supposed to wrap up, so I'm going to let you ask the one question you wanted to ask
It's a
in
simple
return.
one.
That's
Where in
fine.
Germany?
I was born in Munich, but I went back there and I lived in Wiesbaden a couple of times as well. So I lived there probably. I grew up. I went to 14 schools in 12 years, and
Holy cow. Was this
so
military?
yeah, My dad was in the military. So,
God bless him.
but loved Germany. It was a lot of fun, and spent more time in Germany than any other part of the world. So
I lived
growing
there
up.
twice as a private citizen in banking, and then as ambassador, and it's a wonderful country. It just shows to go, yeah, and I'll leave you with this, how much life has changed in a year. Last year, my wife and I celebrated our 25th wedding anniversary, and our four kids gave us, as their present, although I think we paid for it, a weekend at Oktoberfest.
Yeah,
And a year later, there was no Oktoberfest. So it just goes to show, just in this short amount of time, what a jolt this has put into not just the American reality, but the global reality. And the loss of lives is the starkest reminder of that. So please, God, we get through this sooner than later, and we get back to doing conversations like this face to face.
absolutely. Well, thank you very much for the generosity of your time, your insights, and to all those that joined us today. Thank you very much. And we'll turn it over to part two and Dean Lynn Goldman. Thank you. Governor, talk soon.
Hello, everybody. I'm Lynn Goldman. I'm Dean of the Milken Institute School of Public Health at the George Washington University. And it's a great pleasure to be here to lead our discussion about inequity in America, and particularly the deficits in public health and the economy. We have with us today a marvelous panel, Judith Monroe, who is President and CEO of the CDC Foundation, Dr. David Rue, who is the Chief Medical Officer and Vice President for Healthcare of the Microsoft Corporation, and Alyssa Reeder, who is CIO of Common Spirit Health. In launching forth with this as a dean of a public health school, I feel I must start with a bit of a background of what really is public health, because I think this is something that most of the time is invisible to most of you. Certainly in recent months, we've been very visible, but we really are here in public health to serve to address the needs for disease prevention, prolonging life, and improving the quality of life and excellence of health and healthcare for us all. And this is a job that is achieved by many people across society, not just those of us who call ourselves public health experts or deans or professors or public health officers, but really for people across a broad swath of society. And I think we're going to hear about that as part of this panel. It's also a very large and interdisciplinary field. And I think that the pandemic of coronavirus has illustrated the numbers of disciplines that are involved. We've been challenged not only about the virology, the immunology of the coronavirus itself, the development of vaccines and therapeutics to address it, but also with the behavioral science around whether we will wear masks or not, can distance physically or not. Also, the environmental health science about whether the aerosols and particles in the air can spread the virus. The occupational health science about what kind of protective gear people need to have. The health economics, the epidemiology, the modeling, which we do all of the time, and now everybody is hearing about often, and it's become quite controversial, but the biostatistics and health data science is just core. And I thought that Governor Murphy said it very well when he said that public health, he said, is founded on science, facts, and data. And that's certainly true. But it's also true that we have science, facts, and data about all of those things, whether it's about behavior or how to implement a vaccine program. So we have with us today a panel that brings a great depth of experience and expertise, but also each brings a different lens through which they can look at this problem. And I'm going to start with asking each member of our panel a single question, which is that from your perspective, and how do you view the health deficits that we're experiencing today? What do you think is the most important deficit that you see as impacting public health, the communities that you work with, and how are you addressing that? And I thought that perhaps I would start with David Rue to hear his response to that.
Well, thank you so much, and it's a real pleasure to be here. Again, by way of background, I'm also not only the Chief Medical Officer at Microsoft, but I'm also an infectious disease physician and health services researcher who spent a lot of time thinking about how technology can be used to address issues related to access to care and quality of care and inefficiencies and inequity. And so the lens that we provide, or at least I'd like to be able to provide as part of this discussion, is how technology may be able to help us address some of those great disparities. And as was mentioned by the governor, what we know today is these have been around for centuries. And what we have seen with COVID is that we have an exacerbation of the disparities, which has resulted in those that need it the most, that need the services, that need the care, are perhaps not receiving them, and that's leading to the worsened outcomes that we see. So everything that we've known in the past has been worsened, both from a healthcare perspective and from an economic perspective. And as we think about what will happen after the pandemic, we anticipate that it will not revert back to the normal. At least the normal will be a bit of a new normal, in which case there will still be a significant amount of virtualization of activities and desire to continue to stay somewhat socially distant. So as we think about that issue of where we will be a year from now, 3 years from now, 10 years from now, we need to start thinking more broadly about some of the issues that will allow us to be able to enable more of a digital economy to close that digital divide. And those are the things that relate to things such as broadband access across the country, that relate to digital reskilling, and an opportunity for us to start thinking about how we can enable individuals to be able to get back up on their feet, but do it in a way that will reflect the current new economies and the new realities. And so these are all the types of things we're looking at it from a, excuse me, a healthcare perspective, but also from an economic and a lifestyle perspective. And I think all those things will need to be addressed if we want to solve this problem.
Thank you for that. Turning to Judith Monroe, Judy, you and I have for years been involved with making efforts of many kinds to help to improve the public health infrastructure in our country. And it's been actually quite disheartening over a number of years, as the governor said earlier, to see how in many ways the system has not kept pace with the modern world. Just hearing from David Rue reminded me of how some of my own team, who was reaching out to volunteer in some of our local health departments right around Washington, D.C., found that they were still filing paper reports to CDC via fax machine rather than via electronic secure lines. And so that we truly have had the challenge of bringing public health into the 21st century at the same time that we have been responding, obviously, to the largest public health challenge of our lifetimes. Perhaps you could give us your perspective on what you think the biggest issue is, and how you at the CDC Foundation are addressing that.
Yeah, thanks, Lynn, and great to join you and my fellow panelists today on this really critical topic. The deficits in public health are so very real and so very dangerous, and do have a negative impact on our economy. So when I take a look back, as you said, the work that we've done over the years, if you look at the U.S. public health system, it's really been underfunded for decades, despite the fact that there have been warnings to policymakers at the federal and state level about the dangers of a weak public health system. And then you couple that with the many warnings that have been out there about how the world could be facing a pandemic such as the one we're facing now with COVID-19. Which has really underscored that the public health funding is a matter of economic security and cost effectiveness beyond just population health as we think about it. So just to give folks an idea of how serious this is, there was a recent government spending analysis showing that state health departments had seen a drop since 2010 of 16%. Per capita drop in spending. Local health departments, 18%. We've lost 38,000 state and local public health jobs since 2008, and those have not come back. And then what we see is reactionary emergency spending. I mean, this is one of the big problems that we've had over the years. So with COVID, just like Zika and Ebola and others, emergency funding comes, but it's coming into a system that's been chronically shortchanged. And so I hear every day from health departments about the need for additional staff. They also have key skills. There's a workforce issue here that I think is really important. And if we look now at the spread of COVID, just look what's happening in our rural communities, and we have really small health departments that are strapped for resources. And of course, we put a lot more money into health care in this country than we do public health. So the other part, and you started to mention this, our public health workers are also low pay, and they qualify, some of them, for government assistance. You mentioned the paper records going by fax. We have that happening right here in the middle of the pandemic. And then on top of that, because of tax revenues declining, we're seeing the furlough of some public health staff. So it's just terrible. And if it's not enough, one of the things I want everyone to be aware of, if you've not read it in the news, is how our public health officials have been disrespected and threatened on top of all this, and a backlash of the science that they're trying to put forward with masks or social distancing. So basically, we've lacked political will to strengthen public health. And I'm like many people, think that we need to view our public health system like the military. We need a strong workforce. When you think about this is all in the backdrop of climate change. And we've had 40 new dangerous pathogens that have emerged since 1970, jumping from animal to human hosts because humans are entering new ecosystems. And so this will not be our last pandemic by a long shot. And another one could be on the heels of this. We've got to be ready. We just can't afford to allow our public health system to erode any further. And then, really important at the CDC Foundation, we've been looking a lot at equity. Institutions that have inequality and structural racism that have been built into them. The public health implications are very stark as you see how the COVID cases and deaths have clustered in neighborhoods that are racially and economically segregated, clustered in low-wage jobs, limited workforce or work flexibility, limited and no insurance, and yet they've had a lot of exposure to the virus. And then lastly, we need data. We need really public health data modernization is a big area. We lack integrated data, the ability to rapidly analyze the data that has really contributed to the slow response to the COVID-19. We lack strong data sharing standards, which have hampered the ability to formulate an effective response. And we need to unlock the great potential to leverage the electronic health records and to be able to track health data of millions of Americans that would give our health officials a better understanding. So at the CDC Foundation, we're attacking really all of these. We have been supporting our frontline workers during COVID, and we're looking at that as health security is a big priority for us, and that includes helping shore up and do what we can to help our workforce. We just hired a chief health equity strategy officer. We're taking on equity in a very serious way. And then we're front and center. One of our priorities is the data modernization.
Wow. Well, thank you for that. That's a lot. And we're very, it's wonderful that there is such a thing as the CDC Foundation to address those issues. Alyssa Reeder, I want to turn to you now. If all politics are local, certainly all public health is basically local. And unfortunately, many of the inequities we're talking about also are particularly local. And I would love to hear your perspective on the question.
Sure. I think that to address the question, enabling broad and universal access to health care and high quality, affordable health care is really one of the most critical things. And our need to sort of support the whole health of individuals is very pressing. One of the things that Common Spirit Health has long recognized are that the social determinants of health are really tied to a person's overall health. And that's why we focus on innovation and well care. So we're trying to coordinate care long before people become sick. And we're working to really achieve our goal to be a more just health system that improves, physical, social, and mental health through expanded access to care and bring about more equitable health outcomes. As several people have talked about, racial inequality issues have had tremendous impacts that have only been really exacerbated and brought more to light through the COVID-19 pandemic. And as Common Spirit Health, we're working to expand our reach and provide care across our communities, which we're in 21 states and have over 700 care sites. We're really focusing on making care more consumer focused, treating the social causes of poor health, developing and engaging the next generation of our healers and healthcare workers, and championing universal access to healthcare.
So, Alyssa, if I could follow up with a question, there's a lot of effort obviously underway to develop a vaccination for the coronavirus. And in fact, there's several of them that are in phase 3 trials now. And I yet to see really what the ground plan is for actually being able to distribute the vaccine and work with communities to have acceptance of the vaccine. what is the role that communities will have in that, and how do we have an effort that starts at the top, in places like the White House and NIH and FDA and the CDC, and yet it's credible for the people in this country, and we'll actually be able to reach the people who most need the vaccine.
Well, I think having experts feel confident that there have been enough analyses and testing to make sure that people really feel confident in the efficacy of the vaccine is critical to its legitimacy, and that will be very important in the current time period, because I think there are a lot of folks who have concerns about the political biases in different news that they've been receiving. But I think also, really, as your point was, getting folks on the ground effectively involved. One of the things that we found when, as you may know, many people moved to telehealth with the COVID pandemic, particularly for things that were not absolutely essential to be physically present with a doctor or a nurse. And I think the estimates that I heard were kind of countrywide. We had around almost 70% of interactions in April were via telemedicine and remotely, and so between doctors and patients, or nurses and patients. And I think that making sure that we bring these trusted advisors in to the kind of distribution system is very critical, because what we found as a health system is when we had administrators from our system call people up to say, hey, do you want to come in person now? We're open for business. Please come in to your appointment in our offices. The vast majority actually didn't really want to immediately come in. I think they were still very nervous, even though we'd put in a lot of protocols and safety measures around how to handle COVID and COVID risks in our workplaces and environments, and for our patients and employees. And but then when we actually asked the doctors to call their patients and say, hey, I think you should be coming in because we need to test you or look at this, people really took advantage of that. It was a huge swing in terms of the number of people who were interested and willing to now feel that it was safe and comfortable. And so I think that incorporating, whether it's trusted community leaders, whether it's trusted health leaders, into really informing the population and encouraging people, I think will be critical in terms of the success of getting people to take the vaccine.
Thank you. So Governor Murphy reminded us that we have a tendency to always want to fight the last war as we move forward. And I appreciated very much the perspective that Judith Monroe gave us, that this coronavirus pandemic is not likely to be the only outbreak that we're going to be dealing with that has to do with basically some of the instability in our systems, in that pathogens seem to be breaking free from the wild and entering the human population, whether it's the coronavirus, the Zika virus, the Ebola virus. We've had many of these experiences now, and we happen to have hit upon a really, really bad one, but it's probably not the last one. But what can we do in terms of developing policies to be more prepared in the future for any of these threats, or even other threats that might be caused by changing climate, weather, natural disasters? What do we need to do from the standpoint of policy to be able to be better prepared and not to just fight the last war? Who wants to go first? I can't see Judith, so I'll call on David again.
Maybe I'll start, and I'd love to hear the other panelists' perspective. I think when we think about policy to that extent, we recognize that this is an opportunity for us to take advantage of the fact that we have a global community that wants to lean in and supporting organizations like the WHO and other organizations that are trying to capture early signs and indications of these infections. We need those communication channels to be open. We need an opportunity for transparency in the data that's obtained. And then we need processes internal within our own country to be able to act on those signals. I think one of the things that we were able to take advantage of, just as an example, once we understood the genomic profile of the virus, that allowed us to be able to accelerate the development of the vaccine, where we are now at the point where we've been able to, within a very short time period, take that genetic sequence, start developing vaccines, potential vaccines, and testing them. This is just an example of how the ability for us to be able to start that process early, enable that, allow us to be able to apply things, some of these newer tools, sharing that in an open manner, and allowing the folks in the global community to be able to take advantage of that. We need to do more of that. We need to start establishing standards that allow us to be able to do this more seamlessly. One of the efforts that we most recently funded was with the CDC, African CDC, to invest a significant amount of time and effort to build an infrastructure to do genomic sequencing for pathogens, which is something that we think will also help with regards to the possibility of capturing things earlier, sequencing them, and being able to share this type of information to prevent and allow us to be able to get in front of these type of infections. So these are the types of examples. I think internally what we have recognized is that we need to start looking not only at the funding of R&D, but the technology infrastructure. So much of what we faced today, in the past several months, that caused us significant pain was the fact that we didn't have a mechanism to be able to know where resources need to be allocated. So this process of identifying where resources are, these could be ventilators, these could be ICU beds, this could be PPE, and then being able to implement a coordinated effort nationwide to be able to allow us to be able to allocate resources appropriately. Those are the types of things that can be accomplished once we have interconnectivity, interoperability, and sharing a lot of this information. And the last thing I want to comment is at the patient level, this is far greater than just simply an infection. It is so interrelated with public health policy, with community action. We talk about the simple measures that people can do. If we just did the simple things, we would probably be in a much better state than we are today. These are things such as face coverings, social distancing, hand washing, understanding when you need to be able to potentially recognize that you shouldn't be in social environments. Those are all the types of things that other countries have done. We can do better in terms of our education and adoption around the need to do that. And we know the results, and we just need to be able to enforce that in many different ways.
David, could you expand a little bit on the issues around data infrastructure? When you hear Judith Monroe talking about the infrastructure in public health, what are your thoughts about that? I mean, are there young people entering your industry who even know what a fax machine is?
You know what, the funny thing is that nowadays, we, as much as we feel like we are advanced in many ways in technology and healthcare and in public health, we're still in the age of the fax machine and the pager. We really haven't been able to take full advantage of the capabilities, but we're getting there with more recent legislation, the CMS interoperability rules, enabling exchange of patient data through open APIs and FHIR standards. I think we're getting to the point where we can enable more liquid exchange of fluid exchange of data between different systems of record. And that's not just within electronic health records and payer data sets, but also within potentially public health databases. And we're seeing a significant interest in building the infrastructure from a public health perspective so they can be coordinators of this process. And that's where we need to get to, where the public health is a key coordinator from a technology perspective as well as from a policy perspective.
Thank you for that. Judith, what would be your advice for policymakers?
First of all, to get to the policy that's acceptable. And we really need multi-sector coalitions, and we need the business community to understand these issues and how important they are, and how interlinked. So I think that's critical. I really appreciated the earlier comments. I mean, I think we're living at such an incredible time of innovation that we do need to, whether that's data, whether it's scientific innovation, we need to be leaning into that and supporting that. But at the same time, when we've got to balance those policies with what we started to talk about earlier with equity and bringing communities along. I mean, it's not going to work if we add to the inequities across the globe. So I would give a shout out to making sure that we're integrating health into all policies, but we're doing that mindful of equity while we're balancing technology.
Thank you for that. I'm going to turn to Allison and ask you the same question. Your advice to policymakers.
Right. Well, I mean, I don't think we'll be able to prevent additional viruses. As you mentioned, things will come in. And I think we have to consider how to manage through them better than we have before. I think some of that is making sure that we reinforce our entire healthcare system by promoting universal healthcare, which encourages preventive care and can improve kind of basic health and basic care, encouraging collaboration and kind of working together across different, whether it's agencies, organizations, resources. We've tried to make sure in many of our hospital emergency rooms, we put in place technology resources which help our doctors and nurses be able to make referrals into the specific communities that they're in to make sure that we can kind of support whether someone needs a referral to a food bank or to a shelter or some other resource, that we have that information available, and making sure that that's something that we're broadly doing across our country and ensuring that we fully support the health. And as I mentioned, kind of addressing those social determinants of health. And the CDC defines social determinants of health as the conditions in the places people live, learn, work, and play that affect a wide range of quality of life risks and outcomes. And the areas that we look at when we think about social determinants of health include housing instability and homelessness, food insecurity, economic stability, education, safety from violence, utility needs, healthcare, family and social supports, transportation, physical environment necessities, do you have clean water? And so making sure that we're really caring for all these other attributes which really support the health and can give you a higher base of health, and greater health will help individuals start off with a better chance of having a better likelihood of being able to fight off and successfully manage through the issues that they may face with future pandemics.
Thank you. So actually, that's a great segue to my next question. Many people who are watching this today are not in fields of public health or community health, or they're not physicians, they're not experts, but do have positions of responsibility in their communities. Many are employers, some may be investors, might be involved in various industries. But I believe that we're all impacted by this epidemic and by the inequities that are created by it. One of the things that I hear frequently is the frustrations of many who need to work, but they are involved in work that perhaps requires leaving the home, being frontline, which puts you at risk for being exposed to the virus. Others who are working at home, attempting to work at home, but their children are also at home, perhaps homeschooling, kind of a divided attention problem with how do you do your work and at the same time monitor your children as they're trying to do Zoom calls and learn online. And frankly, with the schools not being completely open, that for some, it's been necessary to completely even drop out of the workforce in order to be able to take care of children. And that in turn is creating enormous economic inequities and problems in families. And so we've got an issue where the inequities that are occurring, they might have to do with the kind of work people do, which that can be very much related to your income level. It might have to do with your responsibilities for taking care of children. It might have to do with whether your community is able to keep schools and childcare and other entities like that open. But all of us, I think, in our own communities are experiencing these issues. And David also mentioned the internet divide, which is creating enormous inequities as well. But as people leave this session, and what can they do in their own lives? What can any of us do that might be a way to constructively help to make a difference, to address these inequities, to make a difference either whether it's in our community, our state, in the country? What can we do? And perhaps again, just I'll go in the same order and start with David Rue on that.
Yeah. So I think it first starts with awareness of the issue. Right now, we have in many ways figured, okay, well, we've got a process to address some of these access issues. We'll use telehealth or virtual care. We've got a mechanism to address school. We'll use the virtual school mechanism. But what that has done is that has exacerbated some of the underlying issues today, where many individuals across the nation, there have been analyses that have identified there's 157 million people in the United States that don't have adequate broadband access. How can we even do some of these more basic things if we haven't even addressed that? We hear stories of families in a car all huddled together in a Taco Bell just so the kids can all do their schoolwork, just because they don't have broadband access, or they're all trying to go on a cell phone. And then how do you make this affordable? The affordability of the accessibility of it. So these are challenges that we have to acknowledge. And then as we start thinking about how we implement and legislate not only policies, but laws and rules that allow us to be able to address these issues, we will have at least done that in the perspective of looking at where the issues are and how we may be able to address them. Because the people that are most affected are sometimes the ones who are least likely to be able to voice their issues. And so we need to have a very thoughtful approach in terms of who is affected. And it turns out that most of the people that are affected are individuals of color, women more so than men. And we oftentimes find that it is schooling and childcare, as you mentioned, is a big part of what drives a lot of this. The types of jobs also, a lot of the folks that are most affected are the ones who are on the front lines doing more manual work, in which case it's unlikely that they'll even be able to return back to a normal, even their job or what they used to do at the same capacity. And so we need to start thinking about, like, if they don't even have a job or have any money, how can they sustain? So this ties back into a lot of the policies and legislations that we need to rethink as a society and how we'll address this.
That's an excellent set of insights, David. And when you think about it, amongst the schools, there was not equal access to technology before the pandemic. And so there were schools, certainly universities were teaching online a lot already. Some of us, we were more prepared, I think, arguably, than most K-12 systems. But even among K-12 systems, there are great disparities in terms of the baseline access to technology for those teachers, the extent to which they had been trained to use those technologies prior to the pandemic, and were ready to just be thrown into an online system overnight. You're going to teach your curriculum online. Those of us who do that recognize there are many skills that go along with that, not just the skills for using the technology, but also there are different modes of teaching that you use when you teach online that are certainly teachable modes of teaching, but aren't teachable overnight. And so not only are many times the students not prepared, their families are not prepared, but often the schools have not been prepared either. Judith, did you have a response to that?
Yeah, with your question, Lynn, my mind went several levels, and it started actually all of us just being good neighbors. I mean, when you ask what can folks do, we can all start right in our own neighborhoods, our own towns, and finding out where the gaps are, and then creativity. I've been really inspired by some of the creative solutions that folks have had. One thing we've not mentioned is the mental health. That this is, with the loss of jobs in homes. I mean, the mental health crisis that we're experiencing right now, coupled with increased substance abuse, is very serious. And so folks can help by either taking personal action. They can help by supporting the community-based organizations or the national organizations that are addressing these issues that have come to bear because of COVID and the pandemic that we're experiencing now. I talked to, thinking about going back to the public health workers and the stress that they're under as they're trying to help support our schools opening and so forth. A simple thank you goes a long way. We actually have a virtual thank you wall at the CDC Foundation that folks want to come and just post a thank you to the public health workers. I think our teachers need that, our nurses, and it goes on and on. I told businesses, a group of businesses I spoke with the other day, I said, maybe you want to adopt an epidemiologist. I mean, there's it's not just healthcare and public health, but some of the under-resourced areas. Sometimes contributions can be in supporting additional workforce or allowing people to have some days off, those that are working 24/7. And then I think economies, local economies, can become creative in terms of trying to maintain some of the jobs that folks are losing. That's going to require creative solutions, but they're out there, and I'd encourage folks to read up on how folks are addressing these issues that are impacting all of us.
Thank you. Alyssa?
Sure. I mean, I think one of the biggest things is advocating for vital health and social programs. Programs like Medicaid, CHIP, SNAP are the foundation for health in a lot of these underserved communities, and they've steadily eroded and really have to be protected. And we also just have to advance a broader array of health, social, and economic policies that lift up communities of color and folks in vulnerable situations. As I mentioned before, I think we need to work to improve building community relationships and presence. As the largest Medicaid provider in the country, Common Spirit Health has long known that people of color and other vulnerable communities often present when they're sicker, and they stay way longer than they should because they have concerns about not just their ability to pay, but whether they're going to be treated openly and justly, and making sure that people that different healthcare systems train their staffs appropriately to really understand and respect different communities is really critical, and making sure that we're really able to serve every individual. But I think folks need to champion, demand, and create action and wipe out the neglect that's kind of created and forced a second-class healthcare system for people of color. And I think doing it hospital by hospital is the effort that we've really put into it. And I think all of us need to sort of learn, teach, and model and fight for funding for healthcare organizations and make sure that folks have access to good healthcare. And lastly, I might mention community violence prevention. Kind of thinking about community violence as a public health issue, and where people prey on vulnerabilities that leave families and communities that are at risk. Community-based programs can really make a big difference in terms of working on these issues and reducing violence, and supporting those types of programs in individuals' communities with the same level of resources that we direct at acute health needs is really vital for our ongoing safety and engagement and community wellness.
So maybe you could tell us a little bit more about how Common Spirit works in your communities to make healthcare more accessible to people who historically have had so many barriers and even hesitation, especially during the pandemic, frankly, to seek healthcare. Many people have been hesitant to seek healthcare. How have you done that, and how can members of your communities help to support those efforts?
Sure. I mean, we've done work through delivering telehealth, as I sort of mentioned earlier. That was something that grew phenomenally. I think there were several people I heard who mentioned that it was effectively like getting 10 years of growth within a 2-month period, as people really welcomed that as a resource to be able to access their physicians. But one of the other things we've done, for example, is really tried to expand testing, because we know that that's critical in this. I mean, we had I heard our chief medical officer talk and how they had gathered a group in last December to really address how they would deal with COVID if it came to the United States, and how to consider paying all the plans for the surge hospitals and everything else that we were able to do. And I was thrilled that we were that coordinated, and it's a huge benefit to have a multi-state system where we're able to trade and move resources, whether it's critical care nurses or ventilators or PPE, wherever it's needed most and wherever there were flare-ups. And so that was a real help to us, I think. But one of the things that we've had now as an issue, sort of in the country as a whole, has been, our just providing access to testing. And so we opened up a new testing facility in Arizona that's providing results in kind of 24 to 36 hours, and it tripled our ability to offer testing. So we're now at 10,000 tests a day. And so that's one of the things that we're doing, which all of our system has, and I think elsewhere, have access to. And but we also really support our communities through what we call our community investment program, and that's making low interest loans. We also do grants in our communities to support nonprofits and health systems. But through the community investment program, where we're doing loans, we've done over $300 million, well over $300 million since the program was founded in 1990, and really working to both bring people together in that collaborative nature, get different nonprofits to work with each other, which is really helpful, and support those social determinants of health. And so those are all different things, both that we're doing, in our facilities and in our greater communities. And I think Judy mentioned, the physicians, and thanking the doctors and nurses and staff. And one of the things that I really was excited about, because we try to be very innovative in our use of technology and resources and other things like that. But one of the other things we did was we realized that it was really challenging for our staff, who were working in some places, especially when we were more at some local peaks, and working very long hours. And our staff ability to go out and find groceries, particularly when groceries were a little scarce, or toilet paper or whatever it was, in our communities. And we actually turned our cafeterias, which we were no longer using as cafeterias since people couldn't gather and eat in close quarters, and turned them into supermarkets for some of our employees and some of our hospitals. And so they were able to go and collect the groceries that they needed for their family. And it was a benefit that we kind of gave to our employees to be able to access that. And it had effectively, kind of any hours you wanted. And so our staff, who were working very unreliable hours and extended hours, were able to take advantage of that. And so I think, again, we try to be creative and thoughtful about responding to all of the different constituencies, and supporting our employees who are doing such great work with our community members and with our patients.
It's really great. It's really great. So we just have a few more minutes, and I want to do kind of a very quick round about what we're facing right now this fall. I think we're all aware that across our country, the numbers of new cases are going up pretty dramatically every day. And that theoretically, for what we know about viruses that are respiratory viruses that spread like the coronavirus spreads, that fall and winter are likely to be worse because people are indoors more. So realistically, we're expecting that we're entering into another phase where we need to be careful. What are you doing? And where you work, or in terms of the policies that you're working on, or the programs you're working on, what are you doing to prepare for fall? What do you think is the most important thing we could all do to prepare for fall? And perhaps to start again with David.
Okay. Well, I'll tell you, we've heard this before, we're all tired of COVID. And I think as Governor Cuomo had said, the virus is not tired. Unfortunately, it's not. And that means that despite the fact that we are finding it difficult and burdensome and inconvenient, and in many ways it ruins our holidays, we're going to have to make those sacrifices and continue to make those sacrifices, especially during this time in which there will, in all likelihood, be more virus circulating in the communities. It's time for us to sort of double down on some of our efforts that we've been doing. Try to see if we can expand the current adoption and utilization of all the things we know that work, masks and social distancing, and not necessarily, kind of doing this in the absence of just simply doing that, but looking at how it's impacted the overall community rates. And when we see test positivity rates continue to go down and trend towards lower levels, then we can start in a very measured manner opening up certain types of businesses and activities. But we do that in a way that is consistent with what we're seeing relative to the virus circulating out there in our current trends. And that really is what we have to start doing. We have to start allowing science and the public health measures to guide our actions and allow us to be much more in front of this as opposed to responding when it's too late and trying to catch up at the end. It doesn't work that way with this pandemic. We have to get in front of it. We have to start trying to identify ways to lower the community spread. And from there, it will allow us to be able to do the things that we would like to do.
Thank you, David. I just turned to Judith. Your response to that?
Yeah, so we're kind of viewing this as if this were, a basketball or football game. It's we've just been in the huddle trying to re-energize the team because we really need the rally call. Folks are tired, so we've been doing a lot to try to inspire our staff and mobilize them. We're going to have a virtual talent show as an example to kind of celebrate holidays, and folks are getting excited about that on the creative side. In terms of our work for the foundation and supporting public health, we're doing something called Crush COVID. It's got 3 pillars. It's doubling down and supporting our frontline public health and healthcare workers in a number of ways. Equity is one of our pillars, and then communications and critical communications is important. And that we've mentioned the vaccine. We've got to start now getting folks confident with the vaccine and understand that's going to be complicated. This is going to be daunting when the vaccine is ready to do the rollout. And then we are also doubling down on our messaging around masks. With the increased cases, we still have far too many people. I think I saw something like maybe 50% of Americans wearing masks. We've got a long ways to go to overcome and bring people along with just the simple behavioral things that they can do to prevent this. And of course, flu shots, we've got a campaign around the flu is something that we're doubling down on. And then mental health, we have a project underway. Folks can come to our website, actually, and find resources and links to their own mental health, and where you ask questions or answer certain questions, and then it'll take you to resources that are designed for your particular problems that you might be having. So those are some of the things.
And Alyssa?
Yeah, I would very much agree. I thought David had very thoughtful comments around not getting complacent, and both David and Judy talking about masks and hand washing and the importance of that is something that we've been emphasizing both in my family and more broadly in my company and in our communities. In fact, supporting the vaccines when they become available and flu shots always. Within our own offices, we've encouraged folks who can work from home to work from home for a period of time. Right now it's through February, but that could easily be extended. And then, as a corporation, as a healthcare system, as one of the largest systems in the country, we're working to continue to make sure we don't get complacent and that we add to our resources. One of the things that I was most interested to hear was, while there was a lot of talk about PPE being, in shortages and having challenges, one of the biggest pain points that I had heard in our greater healthcare system has been critical care nurses who really can work with some of these very high acuity patients. And I don't know that coming into this pandemic, I had enough appreciation, or I'm sure I didn't have enough appreciation for the different levels of skill and education among nurses, and how non kind of portable it is in terms of moving from one area to another. And so making sure that we've actually made opportunities for some of our nurses to get more education and encouraging and facilitating that to broaden and deepen the resources available should we get a second surge, which could strain the system more.
Thank you so much for that. And thanks so much to our entire panel. We've reached the end of our time. I think, the closing message that I heard from all of you is we need to fight pandemic fatigue. That's an enemy. We need to continue to focus on masks and distancing, hand washing, working at home when we can, but also being kind to each other, and certainly being aware of those in our community who are at highest risk, and anything that we can do to help them, whether it's to access to healthcare, access to education, access to nutrition. This has become very critical, and especially as we move into the winter months, we need to think about that as well. I personally am doing a campaign where I work that everybody will get the flu shot, because remember, people die every year from the flu, but also we can learn how to do a mass immunization campaign if we can try to immunize everybody from flu. We need to do it. I don't believe that it's necessary there's going to be a double hit, but I do know that it's the last thing that we need right now in the midst of the COVID pandemic. So I wish you all well. I thank the Milken Institute for giving us the opportunity to have this conversation today. Goodbye.
Thank you.